Life-saving measures following head injury due to roadside accident should be started immediately at the site of accident in the form of airway, breathing and circulation. The mnemonic is ABC. The airway should be maintained and breathing and circulation should be ensured by a paramedic who is available or by a bystander. And the patient should be prepared to be shifted to a hospital where there is a facility for management of head injuries. The initial management is always maintenance of airway. Prevention of hypotension and hypoxia can save a lot of patients. And the first hour is also known as golden hour after severe trauma. Initial management of airway involves clearing of vomiters, blood from the mouth and ensuring that there is no foreign body like loose teeth. Associated chest injury, abdominal injury and long bone fractures should not be missed and they should be diagnosed early and managed accordingly.
मैं आपको सर्वाइकल स्पॉन्डिलाइटिस से बचाव के कुछ 3 तरीके बताना चाहता हूँ। नंबर 1 है, जब भी आप मोबाइल का या कंप्यूटर का प्रयोग करते हैं उसको अपनी आँख के लेवल पर रख कर करें, जिससे कि आपको इनके प्रयोग के टाइम बहुत लंबे टाइम तक सिर को झुका के ना रखना पड़े। दूसरा, टीवी देखते टाइम यूजुअली हम लोग लेटकर सिर के पीछे मोटे तकिए लगाकर और फिर टीवी देखते हैं। इस चीज़ को टोटली अवॉइड करना है। लंबे समय तक ये करने के बाद सर्वाइकल की बोन्स की स्ट्रक्चर चेंज हो जाता है और स्पॉन्डिलाइटिस होने के चांसेस बढ़ जाते हैं। तीसरा सर्वाइकल स्पॉन्डिलाइटिस बचाव का तरीका है, अगर आप पैरास्पाइनल मसल्स और सर्वाइकल की रेगुलर एक्सरसाइज करें और इसके लिए आप किसी अच्छे फिजियोथेरेपिस्ट की गाइडेंस लें। पैरास्पाइनल मसल्स अगर स्ट्रॉन्ग होंगी तो सर्वाइकल स्पॉन्डिलाइटिस होने के चांसेस कम होंगे।
Lumbar disc collapse is the most common cause of low back pain. Most of these episodes of low back pain can be treated conservatively with periods of bed rest, analgesics, and physiotherapy. The key is to prevent disc collapse by avoiding undue bending and weightlifting and strengthening your back by doing regular back exercises.
Meningiomas are most common primary brain tumors arising from ethmoid capsules associated with dura mater or quadriplexia and accounts for 36%, that is more than 1/3 of all CNS tumors. According to WHO criteria, 3 grades of meningiomas are there. Grade 1, 60 to 70% are benign. Grade 2, 20 to 25% are having decreased chances of recurrence, and grade 3, 1 to 5% are malignant with metastatic potentials. Most common symptoms are headache, seizures, focal neuralgia, boxing seats, and radiologically you will see an extracellular mass with dural tail, uniform contrast enhancement with peninsular extension.
Tuberculomas are the clinical manifestation of tuberculosis, wherein various lesions or tubercles are formed in the brain parenchyma. It can lead to various symptoms like headache, vomiting, fever, seizures, neurological deficits, or can cause raised intracranial pressure or even meningitis. Most of the tuberculomas can be treated by medical management like anti-tubercular drugs, which are usually taken up to 1 year. Some lesions which are causing mass effect or rays not responding to treatment may require surgical excision.
Fall from height is one of the most common causes for brain and spine injuries. Make it a point not to allow small children to play in the balconies alone. Rather prefer open places for the same. Also make sure the railings are high enough and have adequate lesser gaps so that the children don't fall into such mishaps.
On this occasion, let me address the most common socio-economic event, that is road traffic accident. In a road traffic accident, there will be multiple organ injury. I'll be concentrating on head and spine injury, and I'll be giving a tips on the first aid of cervical spine injury. First, how to identify cervical spine injury? In a severe head injury patient, always suspect a cervical spine injury because 4 to 5% of patients will have a cervical spine injury. In a patient, constant patient, when patient complains about weakness, numbness in the upper knee or in the lower knee, always think about cervical spine injury. Or when there is a high force inward in vehicular accident, always suspect cervical spine injury. Or if you find an unconscious person in an ordinary position where neck are twisted, body is twisted, always suspect cervical spine injury. What to do when you find unsuspected cervical spine injury patient? Here are the tips. First, keep the patient still. Don't move the neck or body unnecessarily. Don't move the patient alone. Talk for the hand. And the main thing is airway, breathing and circulation has to be checked and has to be get rectified. And the final thing is ship the patient to tertiary care hospital for further management of a cervical spine injury.
So today's topic is pituitary adenomas. So as we all know, pituitary gland, a very small gland and the size of a pea in the center of the brain, situated in the sana dasada. So we have a different kind of patients presentations. Patient do present with the pressure symptoms of the pituitary or secretory symptoms of the pituitary. So most common age group is around 30 to 40 years, although it can occur in any kind of age group. And females are most commonly affected than males. And as we all know, pituitary gland tumors are hardly a 10% tumors of all brain tumors. And these are non-cancerous and benign tumors. They don't spread to the whole of the body. They're situated at the place where they are. So need not to worry about them. But the main thing is that we have to diagnose it as early as possible to get the result.
Good morning. So I have been asked to say something about the brain tumors. Look, there are hardly any causative factors to produce brain tumors. So even if there are very few. But regarding brain tumors, one must understand one thing. I think the key to the whole situation is early diagnosis and treatment. Many of the brain tumors are completely amenable to excision. Excision means cure. So this would hold for tumors like ones which are arising from the meninges, that is meningiomas, and acoustic neuromas. Even for the malignant brain tumors, what are known as glioblastomas, surgery and radiotherapy is the key to the whole solution. My own philosophy about malignant brain tumors is that even if the survival is for 1 year or 2 years, and a patient has a good, productive life for 6 months or 8 months, and a tissue diagnosis is made, I think the job is well done. So regarding brain tumors, I feel the situation is positive. It's improving with the modalities such as gamma knife. So never be scared of a brain tumor. Get it treated early and in an aggressive manner.
It's with great pleasure and honor that we gather here to celebrate the World Neurosurgery Day. Special thanks to Shikil for the effort and interest taken by him to organize this event. This was really required to bring all of us on one platform. On this day, we not only celebrate the remarkable achievements, contribution, and devotion of neurosurgeons, but also acknowledge the importance of raising awareness about the neurological disorders and their treatment. As we look to the future, let us reaffirm our commitment to work in collaboration, sharing knowledge, and maintaining mutual respect, refraining from making statements against each other. Also, it is important to ensure our protection from the potential consumer cases through clear communication with the patients and also maintaining the ethical standards. Together, we can continue to make strides towards a healthier and brighter future for all.
Neurointervention is a remarkable fusion of expertise, innovation, and technology. Whether it's treating aneurysm, stroke, vascular malformation, or embolization of middle meningeal artery, the procedure holds the promises of faster recovery time, reduced risk, and improved outcomes.